Now, what's your take on e-cigarettes?
Yeah, a lot of work being done on that, obviously, and a lot of people feel that it helps a lot of people to definitely use less nicotine. In terms of the complications of smoking, uncertain as to whether it actually reduces the risk long term for some of those things. But what is nice about it is the different oils that you get. Obviously, you can bring down the dosage of nicotine. You get different strengths, obviously, of the oils that you're using in those e-cigarettes. And you're not having the effects of the harmful carcinogenic tar that's burnt in a traditional cigarette, and in terms of polluting the environment, in terms of burning fuels, for example, other fuels and other materials. So one would certainly consider that, and then the filtering aspect is also a big one to consider with e-cigarettes. What people must understand is that there's a host of medical problems and genes that are switched on by smoking, and that's what people don't realize. The genes for breast cancer, stomach cancer, skin cancer, and so forth, that are definitely triggered and switched on when we smoke long term. And I think that's something that many people and members of the public are not aware of.
Now, if I came to you today and said, I want to quit smoking, I don't smoke, but hypothetical situation, that I want to quit smoking, what would you recommend?
I'd recommend a multifaceted approach. I'd firstly want to get your motivation. What's driving this? Is it a health decision? Did you lose a family member from a heart attack, for example? Or are you just wanting to just maximize your performance in sport, etc.? So understanding your psyche behind your motive is very important, because that might have led you to start smoking in the first place. So we look at the root cause. Then we'd look at things like, for example, the lifestyle decisions. How are you sleeping at night? How are you coping with stress? Is it a coping mechanism? Socially, how's your anxiety? Are you socially perhaps a bit uncomfortable and fearful, using the smoking as a crutch for you to be confident and approach someone, like some people use alcohol, for example? And then equip you, obviously, in your treatment plan with those skills, so that you don't need smoking to do it, but that you can actually come off smoking and feel quite good in terms of your self-image, about how you carry yourself socially as well. So that's important. On a physical level, one would look at your exercise. You know, a lot of people struggle initially the first 6 weeks of stopping smoking because of the structural changes, the mucus in the lungs, the coughing, etc., in exercising, for example. So getting fit is something, improving the blood supply, improving the amount of oxygen that can be exchanged by the capillaries, those pockets of air in the lung, clearing the old sediments that are stuck. It takes time, and 6 weeks to 3 months of intensive hard work will pay off later on. So you need to understand that exercise plays a role in your rehab as such as well. And then, of course, medically, there are things that help you with the cravings as well for the nicotine and the withdrawal, especially if you've been smoking 20 or 40 cigarettes a day. Looking at medications and things that could help you with the jitters and the tremors, etc. So we'd approach it from different angles, and certainly get the people and the environment around you to back you up. At work, they must know what's cooking. Choose your friends and your social circumstances a bit better if you can. Go to events and places where you're also surrounded by people that think it's okay not to smoke. And then that's how you'd start. So certainly different angles.